And to you, Dr. Ajibade, considering how this sickle cell actually breaks down the body and most of these people suffering from it are inactive whenever they have a crisis, this could be a very serious relief for them. Tell us more about that.
Yeah, absolutely. This came out 2 years ago. And also, there's actually not the only drug that came out. There's another drug too from the US that was approved. So there are two drugs that are constantly being used now, and I've had different results, heard about different results from it. My challenge, obviously, about two challenges, because we deal a lot with sickle cell disease patients in Nigeria, especially the younger ones, and those coming from remote areas through our foundation. And $10,000 a month, and in this case, about $25,000 to $5,000 a month may be out of the reach. The other challenge is that is only for 16 years old and above. Most kids would we have over 20,000 kids being born each year in Nigeria. Half of them will not live past the age of 5, so they may not even benefit from that drug. But my hopes are up. Hopefully, they'll be able to work out the prices and make it possible to be widely available in Nigeria, especially Nigeria being ground central station for sickle cell in the world. The other problem I have with it is that it's strictly intravenous. So in other words, you have to go to a hospital. The patient probably has to be on admission, and they have to inject it over a period of time. Again, most people who live with sickle cell disease don't always have access to standard hospitals like that, if and when it does come along. But again, our hopes are up for some way that these kinks can be worked through.
Very interesting. And we'll bring you in, Dr. Ajibade. Considering that sickle cell is actually a disease that's preventable if both parents actually go to have their tests, what would you say is the most important thing to be done by young people who are about to go into marriage? We've talked about this test being done, but you still see that even in the modern society that we are, people are afraid of doing the sickle test, this test before going into marriage, so to say, and we keep recording the sickle cell disease.
Yeah, that's a big problem. I don't know how. I know some states have gone as far as mandating and what's the word now? Banning carriers from marrying each other. They've gone as far as doing that. I'm not sure how effective that will be, because those same carriers, if they want to get married, they can go to another state and get married. I understand that. But here's the thing. There are over 40 million carriers with sickle cell disease of the trait. So if any of those two get together, they can get married. And they get married, there's still that risk. There's a 25% risk of them having a child with sickle cell disease. The other problem from what we've seen, because we have, through our foundation, we have kids coming in all over from Abuja and around the country asking for help, and we're giving it free of charge, especially for those in remote areas, is that they don't even know. They don't even know that they have about what sickle cell disease is. And so that awareness still needs to be out there. Also, many of these tests, I'm sad to say, are not accurate. Many times they give false negatives. In other words, they say that the person is AA when it should be AS. And they get married, he gets married to, or she gets married, and then they end up with a child that has sickle cell disease. And all of a sudden, the couple, they're accusing each other of maybe having extramarital affairs because they didn't believe, as far as they're concerned, their test was accurate, they were negative, and now they have a child with sickle cell disease. It's your fault. It's her fault. So those issues are still there. So part of the issue I would strongly suggest is to regulate labs. If you cannot prove you have a specific and accurate diagnostic test for the sickle cell trait, then you should not be doing that test, because that has caused a lot of heartache and a lot of pain.
I think that is, and I say, how feasible do you think that is?
Well, if they can legislate people not getting married, I think they can go as far as legislating which labs can do a test and which ones.
Yeah, because the thing is that most of these labs are actually regulated, but sometimes you find out that you still have quacks to deal with, and it's becoming a menace. Would you be describing the lab system in Nigeria as needing further regulation? apart from what you have said earlier, or the issues of quackery is one that should be looked into, because you keep regulating, but there are those who patronize quacks because that's more affordable.
They have a specific list of labs that are recognized to test and approved of to test for sickle cell disease. That may be a good place to start. So everybody knows which labs to go to get these tests. And if they go to any other lab, they know that they can't be sure about the accuracy of the diagnosis.